This girl is about to make a big mistake because this
There you go.
is one of the most dangerous things a chiropractor can do to you.
Last June, the 29-year-old was paralyzed, and you won't believe how her family says it happened. They say it was a visit to a chiropractor for a routine neck adjustment that changed Caitlin's life forever.
Hey, my name's Jillian. It was 11 years today that I walked into the wellness center and never walked back out. I've been battling full body complex regional pain syndrome ever since, thanks to Dr. Denise.
Today we're going to look into the controversial world of chiropractic. We're going to look at some controversial techniques that they use, and we're going to look at some techniques that you should never let them use on you. What it look like, TV?
I am back! What it do, baby?
YouTube's own Varnell Hill.
Did ya miss me?
Your very own spokesman for the Insidians, wear inside and wear comfortable.
They're so comfortable.
And I'm back with another one. And today, y'all, we're going to get into chiropractic. A lot of y'all out there are obsessed with joint farting. And to be honest with you, that's all chiropractic is sitting there releasing the gases in between some bones, so you're cracking and you're getting that little pop, and that pop is nothing but a gas release. If you don't believe me, listen to the chiropractor tell you for himself.
What if I told you this is fake? Not the crack itself, but the idea that this is fixing anything. Let me explain. You see, when chiropractors adjust your back or your neck and it makes this loud cracking sound, it doesn't actually mean that anything's changing. Bones aren't being moved, joints aren't being realigned. The only thing that's happening is gas being released. It's literally no different than this. Or my favorite example, this. Now, that's not to say this doesn't feel good, right? I like getting my back cracked just as much as the next person, but it's not actually making any long-lasting or realistic change if you have any back pain or neck pain or anything like that. Again, chiropractors can't move your bones, they can't fix your joint alignment, they can't mess with your curves. None of that can be done with your hands. So really, it's just a temporary sensation that can cause some people some pain relief, but it'll only last for a few hours at best. Making long-lasting changes or, getting over pain that's been there for a long time takes a lot more effort. And if that's you, I know you're probably thinking, well, that sounds shitty. What am I supposed to do? Well, number one, don't worry. I created a blueprint to fix exactly that. You're able to do all of it from your own home in less than 20 minutes a day, and it costs less than 60 cents a workout, so I think it's a pretty good deal. And secondly, the fact that chiropractors can actually move your bones or adjust your curve or anything like that is actually a good thing. You see, our bodies are pretty structured and pretty sound, and it's a good thing that it's able to hold its own against forces like someone pushing on your back. If I were able to move your spine by just pushing on it, that would be really bad. Because if that same thing translated to everything in life, just imagine watching a football game and every single tackle ending with someone being paralyzed. So all in all, I found it to be a pretty good thing. So then why do chiropractors put so much emphasis on this cracking sound? Well, truth be told, it's just satisfying. And that satisfying sound paired with the power of the placebo effect, some people really eat that up. And hey, it's a free world. I'm not telling you you can or cannot get adjusted. You can go do whatever you want. And if you enjoy it, please keep getting your back cracked. I'm not here to stop you. But just understand it's not making any long-term or serious changes if that's what you were thinking.
I have the ultimate respect for him coming out and telling us that, especially with him being a chiropractor. My question is then, what do you do and what services do you actually provide? Is it all just placebo and sounds? Because you said, the placebo effect combined with the sound brings a lot of people relief.
And that satisfying sound paired with the power of the placebo effect, some people really eat that up.
So to me, it just kind of sounds like you said that, we get paid to make you think you feel better. And I think that's what a lot of the general public heard, because they really don't take them too serious on TikTok.
Are you sure this is gonna fix my shoulder?
Okay, just loose. Good. Just relax, you're gonna feel a little pop. Okay, good. And breathe. Just relax, take a deep breath.
You said you had pain in your left lower spine behind your fibula. All right. I'm gonna need you to turn your head to the right for me. I'm gonna go slow. All right, I'm gonna need you to cross your legs right here. Put your arm over here. Don't worry, I got you. I'm gonna need you to breathe. Breathe, inhale. Muscle bothering you right here too, right? Okay. How was that? Tell me when to stop. All right. It hurt right there? Okay. All right, supply, relax. I'm gonna just press down right here, all right? You just bear me. Inhale. All right. gonna release all the tensions for all the chewing stuff that you've been chewing, so it can come down fluently. Ready? Breathe in.
But anyway, moving right on along, man, it's plenty or multiple, shall I say, chiropractic techniques that they out here using, and people are getting everything that they can crack.
And that was just the first time that I got that done. Like, I am faithful to my chiropractor, and I think you guys should go and get the same type of service. I've been meaning to do like this promotional video.
This is a viral chiropractor video. Here's everything that's wrong with it. That treatment's kind of the same as just clicking this pen on your neck. The only difference is we put a rubber tip on it so it doesn't stab you, tightened the spring so it clicks harder, made it look fancy and gave it a cooler name, and convinced ourselves it can fix all your health problems with a gentle click to the top of your neck. What convinced us to believe that? The inventor of chiropractic Sun just said so in 1930. I am not joking. The guy said the one and only cause of all health issues is misalignment in the upper neck, and the cure is his hole-in-one technique. And we just went with it. Never mind his other fun quotes like, I don't know anything about anatomy, or germs don't exist, or my personal favorite, I don't read books, or the fact he allegedly tried to kill his dad by hitting him with a car, allegedly.
Damn.
No science, just vibes and aura, and 100 years later, his technique's viral online. Maybe it's more sciencey now.
We often find that there is a contributing factor with a misalignment at the cranial cervical junction. We can realign this area to get the brainstem, blood flow.
Nope, still no evidence that misalignments are a problem. In fact, the opposite is true. Misalignments are normal. Some necks are straighter, some are more curved. None of it's an issue. It's an imaginary problem that they still blame for real problems like
brain fog, anxiety, chronic pain, chronic fatigue, persistent headache, maybe IBS or indigestion, ringing your fullness in your ears.
Nope, none of that's true. And even if it was, clicky pen ain't doing anything about it. If our spines could be realigned with that little force, our species would have gone extinct long before anyone could come up with this stupid idea. Your spine is incredibly resilient. It'll take a lot more than the therapeutic Sharpie to move it.
Fun fact about this video, that's the poking that you would prefer. Of all the poking that's going to go on in this video, that's the poking that you would prefer.
I'm going to adjust your coccyx now. Alright, following the coccyx down, first segment's right here. Here's the second. I'm going to try to reach underneath of this bone right here. We're going to pull this straight back up in the air. Any pain there when I push there?
Not really.
I'm trying to be cool, but goddamn.
About one more here. Good, okay. All right, let me push.
My man was getting cracked in his crack, man. Come on, y'all. Come on, y'all. And ladies, you have to be careful out there when selecting a chiropractor. You have to be very, very careful because you're going to get your back cracked. But if you find the wrong chiropractor, you might go in there and actually get cracked.
Stick out your tongue. Okay, take a deep breath in and out. Breathe in. Let me clear your lung out. Hold it. Did you feel that?
Yeah.
We're gonna do it on inspiration, so take a deep breath in. One more. In breath, deep in breath, deep in breath. Yeah, that was good. So we're gonna lower down to the top of the gluteal cleft right there, and we definitely have a pointing to the right, so the sacrum is tilted this way. So we should be able to do Logan Basic here on that. That's tender, right?
Yeah.
All right, so I'm gonna do a technique called Logan Basic. This helps stretch out the fibers of the coccygeal plexus. Still left? Same, better, or worse?
It's better.
Good.
It's going to take a lot of convincing for me to believe everything he was saying. It sounded like he was making stuff up as he was going along and just feeling everything while he was going along. Didn't look like anything was above board to me. But anyway, moving right on along, man. It's a lot of people out here that believe in chiropractic for everything, even their kids.
Trying to reshape his head and skull.
This was incredibly difficult to watch, and stuff like this has to end. After seeing this video, I felt like I had a responsibility to say something. I don't get angry at many things, but watching this definitely made me incredibly upset. I don't know much about what's going on with the baby, but here's what I do know. This is an infant that was born with something called hydrocephalus. They were also reportedly born prematurely. Hydrocephalus is a condition where there is an overproduction of cerebrospinal fluid, and it tends to build up in the head. And if it's left untreated, it can actually deform the shape of the skull, kind of like what happened to this kid. And for some reason, this chiropractor thought that it was a good idea to squeeze the head and attempt to get it back into a normal position. Stupid! Now here's the thing. In the early stages of development, infants do have a mobile skull, but those areas tend to fuse over time. So if this patient's skull is still mobile and he's actually compressing it, then he's creating brain damage in an already cognitively delayed infant. But if the skull is fused, then what is the point of him applying pressure to that head? And not only that, this chiropractor thinks that somehow he can help this cognitive delay by adjusting the patient's neck. The important thing to realize here is that the patient has an implant inside of their head going down their neck and into their belly. This is a catheter that was implanted by neurosurgeons to allow the overly produced fluid to exit from the head, down the neck, and into the belly. And by adjusting the neck, this chiropractor is putting that catheter in the neck at risk for a fracture, which would require a second surgery in this infant. I wanted to raise awareness for this kind of thing and make sure that people understand this is not a good idea. Do not allow a person to squeeze the head of your baby thinking that that's going to fix the problem. Nor should you get your baby's neck adjusted thinking that that's going to somehow improve their cognition. Please educate yourself on the topic and stay informed.
I'm glad the doctor was able to break it down to us in medical terms. I just know the way little buddy screamed, it didn't sit right with me. It didn't sit right with me. But anyway, moving right on along, man. I'm not knocking chiropractors at all, because actually I had thoughts of going to one because we get 2 free visits a year or something through my insurance. I was thinking about going. But if I was y'all, this is the only advice really that I can give y'all in this video. I would go get your back cracked, maybe get your ankles cracked, but I would not let them mess with your neck or your head or anything above your shoulders, because it's a lot of people walking in, but they're not walking out.
This girl is about to make a big mistake, because this is one of the most dangerous things a chiropractor can do to you. Here's why, and a story to prove my point. As a chiropractor myself, I get asked about this adjustment almost weekly. The Y strap, the towel adjustment, the ring dinger.
So let the head be heavy, look backwards towards me.
Call it whatever you want, all of them are equally as stupid and equally as dangerous. And I will never do it to anyone, and I will definitely never let anyone do it to me. Here's why. For starters, chiropractors don't even formally learn how to do this. In fact, my program only brought it up one time, and we'll touch on that more in a little bit. And the reason it isn't taught is because it's just not practical, especially given the risk. You're doing what we call long axis distraction, which is just really a fancy name for pulling something apart. An easy way to think about this are these lumbar decompression machines, which are pretty common. Except there's one major difference here though. Those are usually done on the lumbar spine with really low speed and really low force. Compare that to this, and now swap from the low back to the neck, where we have much smaller muscles and a few more important structures, things like these ligaments, and oh yeah, this thing, your vertebral artery. And now that brings us to the only time we actually talked about this in my chiropractic school. You see, our professor brought up this towel adjustment only to say one thing about it: never do this adjustment. The reason he said this is because his experience with the adjustment involved his wife, who had went to see another chiropractor for some neck pain. The other chiropractor decided he wanted to try this adjustment on her. She ended up suffering a stroke caused by a vertebral artery dissection. Unfortunately, not shocking, given how much force is often used on this adjustment in an area as delicate as the neck. So, in my opinion, if you have neck pain and you want this adjustment done, you're looking at a best case scenario of probably inflaming and making those muscles much more aggravated and causing your neck pain to get worse, potentially risking something minor like a muscle strain or some ligament sprains. And on the worst case scenario, you're leaving with a serious medical emergency, solely because these social media chiropractors want a big flashy adjustment and a large reaction that's going to get them lots of clicks and views.
This man screamed, "You're hurting me," before a chiropractor snapped his neck and paralyzed him. In August 2017, John Lawler attended the third of a series of manipulations aimed at helping his shoulders and neck. His chiropractor, Arlene Schulten, was adjusting his neck when his widow said that he shouted, "You're hurting me, I can't feel my arms." The chiropractor then carried on treating John for a moment before realizing that he was unresponsive. The previously healthy man was described as a rag doll before being rushed to York Hospital. There, his family learned that John's neck was broken and he was now a paraplegic. The only thing doctors could do was a 14-hour surgery to install a neck brace, which was going to likely result in his death. At this point, John mumbled something which his family determined as a no, and they let him pass away in his hospital bed. This case took place in England, so I'm not familiar with the laws, but the chiropractor was initially charged with manslaughter, but those charges were dropped. She was also cleared of any misconduct. John and his wife had wrongly assumed that the chiropractor was a doctor because she was introducing herself as Dr. Schulten. But this is your reminder that you can go to a chiropractor, but just know that they do not have to graduate medical school. To each their own, but I personally will never visit one.
And it's kind of easy to get your neck snapped in some of these offices because these people are used to twisting people's heads around, and maybe your head might not twist that far, and then you end up paralyzed.
Snapping necks and cashing checks.
See, he would have paralyzed me, man. She got 4 clicks in her neck. I only got 2. And how would he know I only got 2? He would at least try to get 3. He would have snapped my neck in that office.
Oh, I'm hurt. Oh, my neck, my back, my neck and my back. Oh.
Don't allow people to play with your neck. Nobody.
So here's a little story time on how I ended up like this. So 3 days ago, I went to the chiropractor because I had ringing in my ear. Well, the chiropractor adjusted me, and then that night I went home. And later on, I ended up with a splitting headache. I went to the emergency room and told them all of my symptoms. Ear ringing, pressure in the back of my head. But now I feel really dizzy. You know, I've got a little bit of tingling in my fingers. My tongue was a little tingly at the time. And he immediately wanted to do a CT scan. Boy, was I glad he did that. In the CT scan, he found that the chiropractor, when he was aligning or whatever they do when they work on your neck, he actually ruptured, or what they call dissecting it, I guess. He dissected my cardiac artery in my neck on the left side.
Last June, the 29-year-old was paralyzed, and you won't believe how her family says it happened. They say it was a visit to a chiropractor for a routine neck adjustment that changed Caitlin's life forever. This 3D rendering shows what should happen during a neck adjustment. The chiropractor uses their hands to apply a sudden force to rotate or thrust the neck to pop a stubborn joint back into place. But Caitlin says things went horribly wrong.
She heard a crunching and felt something crunching in her neck.
4 arteries in her neck were ruptured. She suffered multiple strokes and cardiac arrest. Her mother, Darlene, was devastated.
Right there. She has no ability to swallow.
Her brother gives her water and food through a tube in her stomach. Caitlin uses a letterboard to talk.
I'm definitely lucky to be alive.
Now she's getting used to her new home in Savannah, Georgia.
Everything is designed with you in mind. The oven is down low so that you can reach it.
A little over 3 years ago, I almost died. I went to a chiropractor I had never seen before. He cracked my neck and tore my 2 vertebral arteries in the back of my neck. I survived for 3 days, miraculously. When I did finally end up at the ER, all the doctors were absolutely shocked that I was even alive, let alone that I had been alive and survived for the last 3 days. The only reason why I made it to the ER was because when my mom was like 22, she saw a story on Dateline about a model who went to a chiropractor, got her neck cracked, took a nap, and never woke up. So when I told my mom that I had gone to the chiropractor and I wasn't feeling good and I was having vision issues, that's the first thing she thought of. Because of that, I had made it a point that I wanted to share my story. The 2 birthdays after this happening, I shared my story. But this past birthday, I didn't. And earlier this week, I was reminded why I should share the story at least once a year. A family friend of mine reached out to my mom and told her that her daughter actually went to a chiropractor, got her neck cracked, and was experiencing the same symptoms I was. The only reason why her daughter went to the emergency room was because her mom remembered my story. And sure enough, this young woman also suffered a vertebral artery dissection. And had she not heard of my story, who knows if she would be here today. All this to say, now I've said my story in grave detail and I'll spare you the details. Do not get your neck cracked by a chiropractor.
I understand that chiropractors have done great things for many, many people. But if you ask any neurosurgeon, any doctor, they will say the same thing that I am saying. There are way too many important arteries in your neck that lead directly to your brain that it's just simply not worth getting your neck cracked. The thing that I tell people all the time is, you're more than welcome to go to the chiropractor. You're more than welcome to get your neck cracked. But just know that the consequences and the side effects of getting your neck cracked by a chiropractor could be you becoming paralyzed, you having a stroke, or you simply just not being alive anymore. As long as you are aware that those are the consequences and you decide to go forward, all the more power to you. But I did not know that those were my possible consequences. And had I known that, I would have never ever let that happen to me. So I'm just here to inform you that those are the possible consequences and side effects of you getting your neck cracked by a chiropractor.
She walked around for 3 days with a broken neck. There's plenty of horror stories out there. If you're not getting your neck broke, you're suffering strokes.
If you go to the chiropractor, then you're going to want to watch this video. It could very well save your life. If you've been around for a while, you've noticed in my videos, sometimes I have to pause and actually work hard to think of words. And this is because I have a condition called aphasia, which was caused from a stroke, which was caused from going to the chiropractor. At the back of your neck, you have 2 vertebral arteries that wrap around your spine and go up into the base of your skull. You're probably like, get on with it, lady, just tell us the story. Well, in 2015, I was signing in to take my national registry to become a paramedic and do my psychomotor exam, and all of a sudden, I lost my vision, I got super dizzy, and my eyes started bouncing back and forth. I'll show you a video of that. I went to the ER that night, and they did a bunch of scans and tests, asked me if I was on drugs, and they sent me on my way. They said it's a negative finding. You go to the chiropractor, and they manipulate your neck, and they turn it to the side, and they crack. They turn it to the side, and they crack. This vein gets twisted because of the way it's torqued, and it cracks the internal lining of the artery. I was sent home from the ER, negative findings. I continued to be blind for 4 days. Eventually I was able to gain my balance, but I still had neurological symptoms. So I went to my primary doctor at the time, and she said she didn't find anything wrong either. They thought I had Lyme disease, which turns out I didn't. So again, I didn't have any answers, so I didn't think much of it. And I went home, and I was unable to work at the fire station, obviously, because I couldn't see. And I really was in kind of bad shape, both mentally and physically. But 2 weeks later, I was at a drive-in movie with my family, and I felt a pop in the back of my neck, and lights out. But this time, my husband asked what was wrong, because I immediately started gagging because I was so violently dizzy. My husband asked what was wrong, and when I tried to answer him, I couldn't talk either. I tried to reach up and touch my mouth, and I realized that my left arm had pinned itself up against my chest. And when I went to touch my face with my right arm, I felt drool coming out of my mouth. And I was like, so, needless to say, we busted ass at the ER, which was right down the road. And I could think completely clearly. I just could not communicate. So, if you're ever around someone having a stroke, talk to them like they can hear you, because they can. Or I could anyways. So we get to the ER, they do an exam. Again, negative findings, no one could see anything. They kept me overnight because my husband was like, something is wrong, we don't know what's going on with her, and obviously this is not normal for a 29-year-old female. So the very next day, a hospitalist came in, and he literally saved my life. He called my insurance company and said, I need to do more scans on this girl, fully expecting to find MS, but when he did the MRI, he found what he called was a starburst stroke, which means both of those vertebral arteries have been dissected and have been throwing clots up in the back of my head, and they look like a starburst, and you could see them on the scan. If I have a picture, I will include it, but it looked like little BBs in the back of my head. What had happened the night before was one of those arteries in the base of my head had ripped out. That pop was ripping out, and the base of my head was full of blood. But unfortunately, there wasn't anything they could do other than to transfer me to a different hospital where they could monitor me and put me on blood thinners, which is exactly what they did. For group online and started talking to other stroke survivors that had the same injury that I did, the vertebral artery dissection, and a lot of them weren't so lucky, so I'm pretty sympathetic to stroke victims. The only thing that I came out with was I have aphasia. Obviously, I can't think of words. I play stroke charades whenever I teach or am around people that I don't know. I'm like, I'm okay. I mean, like, not really okay, like mentally probably, but I'm okay physically. And I also have some numbness, like on the side of my face, my pinky down the side of my left arm, and I can't feel my left leg, which is weird because I can still walk on it just fine. but if I touch it, it feels like it's somebody else's leg. I don't know how to describe it. It's really weird. And every now and then I'll like jerk my foot and biff it. And I'm like, again, I'm fine, sort of. So the point of this video is just tell you that I was a perfectly healthy 29-year-old and I went to the chiropractor and I almost died. It was a pretty scary situation, and I'm just sharing that with you so that if you go to the chiropractor and you get your neck manipulated, this is absolutely something that could change your life forever.
Believe it or not, y'all, we have seen the lucky ones in the video so far. The people that have had dangerous encounters at the chiropractor's office, and they can tell their story about it. It's a lot of people that are not here today from simple chiropractic appointments.
A neck adjustment from the chiropractor killed this model in 2016. Katie May was dubbed by Playboy the Queen of Snapchat, and at one of her photo shoots, she pinched a nerve in her neck. She went to see a chiropractor, but after the appointment, she tweeted this. Because the pain persisted, she decided to go again a few days later. And little did she know, she was actually documenting the circumstances leading up to her death. Her neck adjustment had damaged an artery, and this halted blood flow to her brain. And a few days after her appointment, she suffered a stroke. She spent several days unconscious in the hospital before being declared brain dead, and her parents decided to pull the plug on February 4th, 2016. According to the coroner's office, her cause of death was listed as blunt force trauma to the neck, and it stated that her death was the result of a chiropractic procedure. Her 9-year-old daughter, who she was raising alone, was left motherless, and her family filed a wrongful death lawsuit against the West Hollywood chiropractor that caused the injury. According to their lawsuit, the chiropractor Eric Mark Swartz failed to disclose to Katie all the possible negative side effects, including death. The odds of something this severe happening are like 1 in a million, but I still feel like it's important to know, which is why I'm making this video.
That was not the relief that young lady was looking for. You have to be very careful out here. And like I keep reiterating all through this video, I just wouldn't allow anybody to play with your neck.
Protect your goddamn neck, all right?
But I'm not a medical professional. So what does an actual doctor have to say about this?
My thoughts as a medical doctor on chiropractic adjustment, I will be brutally honest. First, just a level set on this, because I think it's a really common misunderstanding. Chiropractors do not go to medical school. They are not medical doctors. They go to chiropractic school, which is a totally different thing and a different craft. So because of that, I did not learn a ton about chiropractic in medical school. Aside from, of course, the basic theory, which is that regular adjustments, mostly spinal manipulation, can help improve ache, pains, musculoskeletal issues, as well as potentially other health issues, and can improve just general well-being. Now, there's not a whole lot of evidence that this works well for disorders other than musculoskeletal back pain, which is an area that many patients do report they feel better after they get a chiropractic adjustment. The other big thing I learned in medical school was one of the hallmark risks of chiropractic adjustment of the neck. Now, this risk is injury to the vertebral artery, and usually what happens is a dissection of that artery, and this can cause a stroke, which even in some cases can be fatal. Now, this is probably very rare. One estimate that I read was 1 in 20,000 adjustments, but I was taught in medical school, we all were, it was on our exams, because it's one of those can't miss diagnoses because it can be so debilitating and, like I said, potentially fatal. So for anyone who's considering chiropractic treatment, I would just say avoid those neck adjustments, particularly the high speed or high velocity neck adjustments. But if you want to go ahead and try different types of adjustments in the spine, like for lower back pain, for example, it may be worth a try, as long as before the treatment, the practitioner goes through with you what are the risks and benefits, which, by the way, you should have before you undergo any medical procedure, whether it's done by a medical doctor or any sort of alternative practitioner. You always need to understand the risks and benefits that need to be explained to you before any type of procedure. So if you go through that and if you feel comfortable, then, you know, it's one of those complementary and alternative medicine approaches that some people may find helpful, and some people may find it helpful just because of its placebo effect, which is also fine. I actually think it's fine to harness placebo if people are open to that, but those are my two thoughts.
She had a black leather blazer on and it looked like it was butter soft. I believed every word she said, man. I'm sorry, man. The black leather blazer got me from the door. I believed it. But anyway, man, that's the crazy world of chiropractic, man. Like I keep saying, just don't let them play with your neck, man. Go back fart all you want. Let them twist your neck and let them get all the farts out your spine, out your kneecaps, out your ankles, out all your fingers. Get all the joint farts you want, man, but leave your neck alone. You start playing with your neck, you never know what the side effects and the repercussions could be, as you can see by the people in this video. You have been warned. But anyway, man, we have reached the end of another journey, so this video is going to end like all the other videos. Hit me up in the comment section and let me know how you feel about everything you have just witnessed.
Tell me how you felt about what just happened there.
And if you done made it to this point in the video, you are my MVP.
It was a stone groove, my man.
I'm out of here.
What's one thing that people say in your profession that's pretty much always a lie?
So glad you asked. I am a chiropractor. So how much time do you have? We have just as much training as medical doctors. You need to come in several times a week for several months. You need maintenance care. You need to buy this supplement. If we don't fix that curve, you're gonna have problems. We can fix that curve. We can fix your scoliosis. You have pain because of your posture. We can cure diseases. We can prevent diseases. We put your bones back into place and change your alignment. We need to take x-rays before we start treatment and after to measure progress. Getting adjusted is just as important as going to the dentist. Getting adjusted is just as good as getting vaccinated. Your baby needs to be adjusted because being born is traumatic. Anything that has a spine needs to be adjusted. You don't need to take those medications anymore. You're in pain because you sleep incorrectly. You're in pain because you breathe incorrectly. You're in pain because you sit incorrectly. You're in pain because you move incorrectly.